Hello there. Welcome to information and training regarding COVID-19. Today I'd like to tell you the what, the why, and the how regarding COVID. What is COVID-19? Why do we have to follow all these rules? And how are we going to minimize the impact of COVID here at CUG? Okay, let's get started. What is COVID-19? COVID-19 is a virus that causes flu-like symptoms in most of those infected, which is contagious and can be lethal. It was first detected in China during December of 2019. It then found its way over to the United States by March of 2020. What are the symptoms? Well, those are fever or chills, cough, shortness of breath or difficulty breathing, fatigue, muscle or body aches, headache, new loss of taste or smell, sore throat, congestion or runny nose, nausea or vomiting, diarrhea. Symptoms may appear 2 to 14 days after exposure to the virus. While the symptoms are similar to the flu, it's more contagious and more lethal than the flu. In fact, it's 3 to 5 times more lethal in those that are hospitalized for those symptoms. Those most at risk at dying from the infection are older, over 65, and/or have pre-existing health conditions. No vaccine was available until recently. The only means of controlling the risk of COVID was slowing the spread of the virus. So rules, policies, and procedures have been implemented to do just that. Why are we being asked to follow all these rules? Well, I'd like to tell you a little bit about the science behind the rules. The primary means of transmission of the virus is through respiratory droplets. This is the liquid vapor in the air you breathe out when you exhale that comes from your lungs. Now, if you've ever breathed onto a mirror or onto a piece of glass, you might notice that it fogs up. And if you run your finger over it, it's wet. And the reason that is because there are respiratory droplets that come out in the air that you breathe out of your lungs. When someone is infected with COVID-19 and they breathe out these respiratory droplets, they contain the Corona-19 virus. Those infected respiratory droplets can then be inhaled by someone else and they can become infected. I have a little object lessons for you, a little illustration. I want you to imagine that this is my face covering here, this is my mask, right? And that these represent respiratory droplets, okay? And the coronavirus itself is very small. It's probably like a piece of salt, but it doesn't just come out by itself into the air, it comes out in these respiratory droplets. And that the surface of your face covering has enough permeability into it to allow you to breathe, but the holes are smaller than the respiratory droplets, so that when you breathe out of your mask, the respiratory droplets stay in your mask, and when you breathe the air that other people have breathed out, and there's respiratory droplets flying around in the air, that they don't get through your mask or face covering. So that's the science behind face coverings. Let me tell you the science behind physical distancing. So they've observed the properties of respiratory droplets, and they actually are subject to the forces of gravity. You know, what goes up has to come down. And they've noticed that as these come out of your mouth and your nose, and you breathe and you sneeze, that these generally fall to the ground after about 6 feet. And so that's the science behind physical distancing and keeping 6 feet apart. So the best means of controlling the transmission of the virus is controlling the exhaling and inhaling of all respiratory droplets at the source, which is the mouth and the nose. This is far more effective than simply isolating people who are showing symptoms because, first of all, those infected are contagious before the symptoms appear. And secondly, about 25% of those people that become infected never show any symptoms at all. So it's far more effective to control the spread of the respiratory droplets than to isolate those people that are absolutely, we know, are infected. Okay, so how are we going to minimize the risk associated with COVID at CUG? Well, we're going to do that by four primary means: physical distancing, face coverings, disinfecting, and isolating. Let me explain to you what those are. Physical distancing. All employees, subcontractors, and visitors are expected to keep at least 6 feet apart at all times. We are also imposing a limit of 10 people in the conference room and in the break room at any one time so that physical distancing can be maintained there as well. That should be pretty self-explanatory. If your workstations don't allow for 6 feet of separation, talk to your manager and we'll figure out a way to design them the best we can. I think we've tried to do that so far, and if there's work left to do, we'll help you out there. Let's talk about face coverings. I use that generic term, but I'm going to break down. They can be masks, face coverings, and face shields. I'm going to give you some definitions regarding what those are. All employees, subcontractors, and visitors are expected to wear a mask, a face covering, or a face shield at all times in the shop or in the office. There are two exceptions to that rule. First, if you work in an office where only one person can work at a time, that has walls floor to ceiling and a door that can close, that's an exception. And secondly, if you're on a break and you're eating, you can be without your face covering. Obviously, you have to get something in your mouth. Let me define, here are the definitions of masks, face shields, and face coverings that are acceptable for use. These aren't my ideas, these come straight from OSHA. A mask is one that fits snugly on the face, is above the nose, below the mouth, and has no vents. Let me give you an illustration. Here's a mask here, and this is not acceptable. See, the nose and the mouth are exposed. This is not acceptable because the nose is exposed and you still can breathe out your nose and the respiratory documents can come. This is not acceptable. I don't know, just because, but this is the proper way to wear a mask or face covering. Over the nose, above the nose, below the mouth, snug to the face. A respirator is an acceptable substitute for a mask. Let's talk about a face covering. A face covering is one that is made of cloth or made of paper, fits snugly on the face, is above the nose, below the mouth, and has no holes or visible gaps in the material. A face shield is one that is plastic, is below the chin, above the forehead, and covers the side of the face. A welding helmet is an acceptable substitute for a face shield. You may bring your own mask or face covering. If you don't have one, we will provide masks and face shields at no cost to you. See Scott Spencer in the safety department if you need one. Feel free to remind each other if you see someone out of compliance. Now, I've never seen anything like that around here, but if you do, you might let someone know. Also, if you're riding in a vehicle for work purposes, all occupants must wear a mask, a face covering, or a face shield. All right, let's talk about disinfecting. We are required to sanitize all common areas, shared equipment, and high-touch surfaces regularly, once every 8 hours. We have someone in the maintenance department performing that function daily, and which has been mostly Keenan so far. Disinfecting kills COVID-19 virus on contact. That's why we do it. We encourage you to wash your hands regularly and sanitize your hands before using shared equipment. See Scott Spencer if you need hand sanitizer. We'll make that available to you at no cost. Also, avoid touching your face or your hands because the respiratory droplets can get on them and then they get in your face and it's no good. All right, let's talk about isolating. And that's the fourth principle we use, the means we use to minimize COVID. I'll tell you how we deal with employees exhibiting symptoms or being exposed to someone who's infected. Reporting signs and symptoms. If you feel you're having symptoms, notify Shannon Klein in the Human Resources Department of your symptoms. Stay home from work. Get tested for COVID-19 immediately. Report the test results back to Shannon Klein as soon as you receive them. If your test results are negative, return to work after the symptoms are gone. If you test positive, quarantine for 14 days and keep in touch with us. Now, if you've been exposed to someone that's tested positive for COVID virus, and the Oregon Health Authority, the local public agency, or a medical provider recommends you be restricted from work to quarantine, here's what you do. Notify Shannon Klein in the Human Resources Department as soon as of the exposure. Stay home from work. Get tested for COVID-19 after 5 days. COVID takes a period to gestate and to manifest. So if you're exposed to someone, you're not going to test for it right away. So wait 5 days before you get tested if you're exposed to someone positive. Report the results back to Shannon Klein as soon as you receive them. If you test negative, return to work as soon as the symptoms are gone, if you ever have any. If you test positive, quarantine for 14 days and keep in touch. If there's a cost associated with getting tested for coronavirus, save the receipt so we can reimburse you. We'll provide COVID testing directly or indirectly at no cost to you. Now, here's our infection notification process. What happens if we find out someone gets infected here at the company? Here's what we do. If one person tests positive for COVID-19, we determine any employees that were within 6 feet of a confirmed COVID-19 individual for a cumulative total of 15 minutes or more. And then we notify those people that were exposed and also affected employees within 24 hours of learning about the infection. We have exposed employees take 5 days off and get tested. Remember the gestation period I talked about earlier. We have the exposed employees return to work if they test negative and show no further symptoms. And any infected employees that test positive quarantine for 14 days. Now that's if one person gets the coronavirus. In addition, if we have a situation where multiple people test positive in a 14-day period, here are the steps we will take. In addition, we'll disinfect the area where the infected employees were working, open the surrounding doors and windows for a while, seek guidance from the Oregon Health Authority on an appropriate course of action, and determine if a temporary shutdown is necessary to avoid or contain an outbreak. That's defined as 5 or more people being infected with COVID at any one workplace. So that's the what, the why, and the how of COVID. If you have any questions, comments, or concerns regarding COVID-19, please see me, our controller, Kelly Cowing. Thank you for your cooperation in making CUG a safe and healthy workplace as we make our way through this pandemic.